All right, we'll get started just right now. With Chapter 4 material, I would not say this is the most exciting material in the world. So I understand that, through it, it forms a framework of what we'll discuss for the rest of the semester. So everything that we know about our body, all the organs, are made out of cells. So we're going to talk about all the different types of cells that we see in our body and how they relate to each other and why we see the cells where we see it. Again, the more you understand that there's a meaning, that there's some kind of reason why the cells are where they are, the better you can appreciate and memorize it for any exam or to even learn how they process them, why they are found there. So let's talk about Chapter 4. Chapter 4 is all about histology. The good news is we've seen 20 examples of this already when we're looking at the microscope. So now we're going to talk about it in terms of not just memorization of what they look like, but where do we see it? Right? What organ do we find these cells? Why do you think they're found there? And I do want you to think about, all right, does it make sense for this cell to be found in that area? Because it should make sense. So let's talk about our main kind of categories of tissues. We have 4 classifications or categories of tissues: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. So those are the 4 broad categories of tissues available. So all of the different cells and organs in our body are all going to be combinations of these different type of tissues. There's only 4 categories: epithelial, connective, muscle, and nervous. The connective tissue is going to be the largest single group, and we're going to see it's a huge category. Now we see it during a biopsy, and if you guys have ever heard of a biopsy, maybe you've had the misfortune of having, usually at your age, your mom or dad having to do a biopsy. And what happens is they did a biopsy, they might think that there's some kind of growth there that might be malignant. So growth can be benign. It just grows. And the weird thing is, the larger it grows in one spot, it's actually a good sign. The real dangerous growths are the ones that grow just a very small bit and then they move and metastasize. Right? So then when we look at any one growth, it doesn't look big. But there's a lot of them everywhere. And then all your body organs are now seeded with this malignant tumor. We call that movement metastasis. And anytime I hear the word metastasis, doesn't matter what kind of cancer, I'm thinking months to a few, maybe 6 months to live, right? Depending on the type of cancer. So if it's colorectal cancer, a few months. If it's pancreatic, maybe a month at most, if it's metastatic. So once you hear the word metastatic, it's usually incurable at that point. And we determine it based on biopsy. We take a look at, maybe you have a breast kind of tumor, and we want to see, is it malignant or is it benign? Some benign ones are just fibroids that can occur in the breast tissue. So we take a fine needle biopsy, take a needle in there, and we remove some of the cells, and we look at it, right? As we look at it, we can see cells that should be there and compare it to the cells that are there in the tumor, right? And then we figure out, all right, if there's malignancy, we need to do surgery and chemotherapy and radiation therapy. If it's just something like ductal carcinoma in situ, where it just stays in one place, we'll remove that mass, maybe radiation, but that's about it. So by looking at the biopsy and the results, we can figure out the treatment plan. And we can also see the risk you might have to passing it along with to a son or daughter. Yeah, kids, boys can get breast cancers. Now, in terms of all tissue types, they start with these 3 embryonic tissues: endoderm, mesoderm, ectoderm. Endo means deep. Ecto means external. So what we get is this, right? When we're first conceived, all we have is one fertilized egg. That fertilized egg that needs to double by mitosis. So 1 becomes 2, 2 becomes 4, 4 becomes 8. Eventually, you have thousands of cells, And some of the cells are on the outside of our globe of cells. Those cells are in the external outermost region. It's called the ectoderm. And the ectoderm forms eventually the skin. And the weird thing is the skin, it kind of makes sense, right? Because it's on the outside, the skin's on the outside. The weird thing is it forms a brain and a spinal cord as well. So that part doesn't make sense. But we'll talk about it later on that because of the way the baby, and it's not even a baby, it's just a group of cells at this point, it will turn into a baby, but because of the way they develop, part of the external cluster of cells gets pushed inwards. Think about what happens if you have a water balloon and you push your finger inside the water balloon. What happens? That latex moves with you, right? As it moves with your fingers as it goes through, now you move that piece of latex really deep. That's what's going to happen when our clusters of cells are going to start to become a real person. You're going to push all those cells in, and then instead of just it's just going to disconnect and stay internally. The endoderm is the innermost layer of the cluster of cells. They form the innermost region of our body, which is the lining of the digestive tract, the lining of the urinary tract. So the lining of those tracts are really, really deep. The mesoderm is the largest cluster of cells. They form the middle layer, and they form tissues such as muscle, bone, blood vessel, lots of different tissues, these mesoderm. Now, again, out of all the adult tissues, 4 categories, they all come from any one of these 3 layers. So the first category of adult tissue is epithelial tissue. Epithelial tissue we saw previously, right? And the category is slide 1 to slide number 6 in our histology case. Right? So what do all epithelial tissues have in common? One, they consist almost entirely of cells. So it's just clusters and clusters of cells, bind and bounded together. Covers body surfaces, forms glands, and none of this highlighted because we're going to talk about each one separately, because each of these kind of areas where we see it, well, it's going to be different cells. So you see, covers the outside surface of the body, stratified squamous cells. We'll talk about it in a few seconds. All right, lining of digestive tract, respiratory tract. Well, I want you to know not that it just does it, but which cells are found there. So none of this is really highlighted for that reason. It's too general. Now, what I want you to know is, in terms of epithelial tissue, they have free, basal, and lateral surfaces. So when we look at a cell, like this one. So here's our simple cuboidal cell right here. It has the lateral surface where it makes contact to the sides of other cells. It's got a basal surface down here where it's connected to our foundation, our basement membrane. And then it's got a free surface on top where it's making contact with whatever goes over it. Right? With these cells, there's always something that goes over it or on top of it. So if you think about our stratified squamous cells that make up your epidermis, there's air that goes through it, right? If you're taking a shower, there's water that goes on this free surface right here. That free surface is called the apical or free surface of the cell. That's where we'll see microvilli. That's where we'll see cilia, depending on the kind of cell. So we have these areas that are lateral, where they make contact with other cells, basal, where they make, and they're kind of grounded to the basement membrane or the foundation, and in the free surface area, where they make contact with the environment. Now the environment could be like this, in the urinary system, where there could be a little bit of urine going through it, right? That's what it's making contact with. So the free surface always is going to be where it makes contact with something else. What else does it have in common with all these epithelial tissue? You need to hold them down to something. You need some kind of foundation to anchor the cell to. If not, what you're going to do is move your skin just a little bit, and the skin's gonna rupture. Now I have told you I'm gonna show you pictures of it, and I will in a second, of kids that have this thing called pemphigus, where these structures, where you're holding those epithelial cells in place in our epidermis. For some reason, those junction points are not very strong. So just even small touch can rip the cell away from its foundation. Now, you guys have all had blisters before. Blisters when you run, right? Usually that's what happens. We have blisters. Blisters is a separation. So then the epidermis part of the skin separates. It hurts, doesn't it? It's not comfortable. Now, can you imagine that happens throughout your skin just by touching your skin? Everywhere you get touch, you will have these blisters, and it hurts just as much. So these basement membrane is this area right here. It allows the cells to be anchored in place. Now, each cell has specialized cell contacts that we'll talk about in a few slides. And this is a big one. This is underlined and highlighted. It's avascular, right? Epithelial tissues are avascular. No blood vessels go into this area. Even your epidermis, right? The actual stratified squamous aspect, well, that area is avascular. This is the reason why you can get a cut. It might hurt, but if it's not deep enough, you don't bleed. You guys have all gotten little small, paper cuts before. It feels like you just ripped your skin completely apart.